This is a statistic graph that shows the number of people affected by leptospirosis in different states in Malaysia. Starting from the year 2004, the number of cases regarding leptospirosis is close to none. As years goes by, the number of cases increases significantly starting from the year 2009. Based on this statistic recent data, the highest number of people infected by leptospirosis is in Kelantan on the year 2015. And most recently, the statistic data shows the number of leptospirosis cases reduces each year starting from the year 2019. This shows that the citizens of Malaysia and governments are doing their best in preventing and reducing the spread of leptospirosis. We will be talking about symptoms that indicate you should seek medical attention as you might be infected with leptospirosis. There are multiple symptoms that leads to leptospirosis, but let's start with the major symptoms. Major symptoms are symptoms that can be easily identified by the infected. The major symptoms for leptospirosis are high fever, headache, and muscle pain. So if you have any of these symptoms, you should be seeking medical attention immediately as prevention is better than cure. Besides that, there are other symptoms that people should be aware of, such as chills, eye inflammation, stomachache, jaundice, vomit, diarrhea, cough, and rashes. With that being said, these symptoms will not appear the same day of exposure to leptospirosis. It will take as early as 2 days and up to 10 days based on the severity of exposure to leptospirosis.
Okay, now we will talk about the chronology of leptospirosis in Malaysia. Leptospirosis has been a significant health concern in Malaysia for decades. It is particularly prevalent in rural areas where there is a close contact with animals and contaminated water sources. The chronology of leptospirosis in Malaysia includes outbreaks and sporadic cases occurring throughout the years, with increased attention from health authorities in recent times due to its impacts on public health. So, the first reported leptospirosis in Malaysia occurred in 1925 among rubber plantation workers and people residing in rural areas. After the government discovered the leptospirosis cases in Malaysia, there were some studies that were performed focusing on the military. From the studies, we found that the prevalence of leptospirosis among military personnel ranged from 4.6% to 34.7%, including two fatal cases which were detected in 1969 and 1978. Apart of that, there are several studies that are also reported that workers in rubber and oil palm plantation, hospitals, sewage, and town cleaning were at a high risk of infection. Several outbreaks were reported from Sarawak State among those involved in cave exploration and chamber visitation. Leptospirosis were also detected in domestic animals such as cattle, buffaloes, and pigs. So, from these earlier reports, it showed that occupation determined the occurrence of leptospirosis. So, there are a few efforts that has been taken to control this leptospirosis disease in Malaysia, typically involve surveillance, education on preventive measures, and vaccination
So,
campaigns
as we
in
can see, this
high-risk
is a data
areas.
that shows the number of leptospirosis cases in Malaysia from 2004 until 2021. So we can see that the highest number of leptospirosis cases happened in 2015, which is around 8,291 cases. Meanwhile, the highest number of death cases that occur because of the leptospirosis disease happened in 2014, which is around 92 death cases.
The cause of leptospirosis is by bacteria Leptospira. This bacteria is commonly from rats and spread to other animals through exposure to the urine. Leptospirosis is a zoonotic disease, which means it transmitted between animals and humans. Humans can get this disease when they have abrasion, cuts in skin, and can get through eyes, nose, or mouth. People can get infected through direct contact with pee, urine, from infected animals, contact with water or soil contaminated by the urine, and lastly, eating or drinking contaminated food or water.
Let's move on to the how to prevent from getting leptospirosis or the precautions to be avoid getting leptospirosis. First, if you are traveling at high risk for leptospirosis, ask your provider about taking medication to keep from getting sick, such as asking for antibiotics from the doctors. Next, wearing protective clothing and shoes if you work with or around animals, such as PPE, to avoid getting bitten or getting into the saliva or any substance that can carry leptospira. So next, wearing protective shoes and clothing if you have to be in contact with water or soil that might contaminate with bacteria. This is usually by the investigators that study bacteria or the disease in a certain area, such as a waterfall area or a river. Next, drinking only treated water. You need to boil the water before you drink it, so that the bacteria in the water itself will be killed, especially the leptospira virus. So wearing glove if you have to touch that animals. Sometimes that animals contains a lot of bacteria by the nature. So if you are going to touch one, make sure you wear a glove. Finally, covering open cuts or wounds with waterproof dressing.